Obviously, we see these ambulances all over the city all the time, and sometimes I'll see them like sitting at Starbucks or Dunkin' Donuts. Are they in there getting a donut, or what's the deal?
A lot of people ask us that question.
Oh, do they?
It's actually something. It's part of our system. About 5 years ago, in 2007, we implemented a new system that we were trying to increase efficiencies in EMS to find ways that we could be more cost effective and improve our response times to emergencies in the community. And we implemented a system we call the MARVLIS system.
MARVLIS?
MARVLIS, yeah, it's an acronym. It's a long acronym, but basically what it does is it's a computer system that looks at historical call data out of our dispatch center and is able to predict where the next call is going to occur.
Okay, so back up for a minute. You said out of our dispatch center. So when there's a 911 medical emergency call, it goes to the medical center.
Yes, when you dial 911 in Jersey City and in many areas of Hudson County, the operator will ask you, please fire or medical. And if you say medical, it's transferred over to a room inside the Jersey City Medical Center where we have 5 dispatchers operating that are certified emergency medical dispatchers. They answer the phone, they ask you some questions that have been screened by the National Academy of Emergency Dispatch, and then they relay that information out to the units in the field.
Okay. So talk a little bit more about this MARVLIS system. You've got ambulances that are deployed out into the community, and you sometimes call this thing, I know because I've seen it, the blob.
Yes.
So why do you call it the blob?
Well, we call it the blob because it actually looks a lot like a weather map. It's actually a screen. It's a map of Jersey City and Hudson County that's up in front of every dispatcher in our dispatch center. Okay. And it looks like a weather map, and they basically move the ambulances to the area on the map that it looks like it's raining the hardest or the darkest areas.
And how do they know where it's going to rain the hardest?
And well, it's not raining. That's where it's telling us the emergencies are going to come in.
Right, but how do they know where the emergencies, the next emergency is?
Yeah, the computer's looking at historical data over all of the years that we've been collecting, and it's basing it on time of day, day of week, and season. And it really is quite logical when you think about it, because it's looking at what's going on with people. Unlike other services, like say the fire service, which is responding to buildings, which don't move. You know, if you have a building that's that's likely to catch on fire or has a high probability, it's going to be in the same place. So you can put a fire truck right next to that location and have them able to respond.
Right.
But people move all day long.
Right.
So we need to make sure that our ambulances are moving with the people to where it is that they're going to be at any given point in the day and where it is that we know emergencies are going to occur. And that's what the system does.
So you've got this system. Someone calls 911. They say it's a medical emergency, gets transferred to the medical center, and then the dispatchers then send an ambulance that's closest to that person because the ambulances are deployed out in the community.
Yes, and actually the system worked phenomenally well. It worked better than even our best anticipation. We were able, by implementing this system, to reduce our average response time from right around the national average, about 8 minutes and 49 seconds, to less than 6 minutes. So we reduced our response times by more than 30%. And we did it with less ambulances on the road. So we were able to be cost effective, but still get the care to the patients.
Wait a minute, how do you do that? Jersey City is a crowded place. And you mean to tell me that the average response time is only 6 minutes?
Yeah, it's pretty phenomenal. And the system has truly proven itself not only to work in reducing response times, but in increasing survivability of cardiac arrest.
Wow.
We found before we implemented the system, we had a resuscitation rate of about 18%, which is even now the current national average. And since then, we've been able, by using this system, and we're able to increase our resuscitation rates to nearly 40%. And with some additional clinical advances that we've implemented over the last couple of years, now we're nearing, and sometimes over 50%.
Wow, that's fascinating. We'll be right back. We'll talk more about the EMS service at the medical center.
Jersey City Medical Center consistently receives the highest hospital ranking and ratings in New Jersey. #1 overall hospital in the state, #1 for high-risk pregnancy, #1 for neurological disorders, #1 for stroke, Magnet Award for nursing excellence, A for hospital safety. What makes the Jersey City Medical Center the #1 hospital in the state? Top-rated, award-winning medical professionals you can see today at the Jersey City Medical Center. Make the #1 hospital your first choice, the Jersey City Medical Center. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for nursing excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org. Jersey City Medical Center, Hudson County's #1 hospital as ranked by the U.S. News and World Report. Why? Because of its patient care, not its bottom line. Jersey City Medical Center, for patients, not for profit. The Jersey City Medical Center accepts all patients and most insurance. At the Jersey City Medical Center, your health is our concern, not our bottom line. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center, for patients, not for profit. Visit us on the web at libertyhealth.org.
Welcome back to the Medical Center Show. We're talking about the EMS service at the Medical Center. So Rob, you were telling me about this MARVLIS system.
Yes.
It predicts kind of where the next emergency is going to be called, right? I mean,
Yeah, it's hard to believe, but it's true.
Okay, so that's why those ambulances are sitting out in the community?
Yes, we move them all day long to various locations in the city to bring them close to where the emergencies are going to occur. And when you talk about places like Dunkin' Donuts or Starbucks,
Right.
we have to do what's right by our staff. So we make sure that they're moved to areas where there's bathrooms and places where they can get food and drink. And
But so like in the morning time, is it more prevalent that you might have an emergency along the waterfront where all those people are working, or what's?
Exactly. So like I said, it really is kind of, it follows what you would logically think, meaning that in the financial district, for example, we need more ambulances there during the day than we do at night.
Right.
And in comparison, in some of the residential communities where people are going to work during the day, we don't need necessarily as many ambulances in that location.
Okay. Now, you said that our cardiac survival rate has really improved because of this. Tell me a little bit about what happens when somebody has a cardiac arrest in the field.
Okay, so basically, if someone if we get a phone call that someone is in cardiac arrest, or even if our dispatchers are able to ascertain that through their questions, immediately the dispatcher will begin what we call pre-arrival instructions, which means that our dispatchers will actually begin walking the person on the phone through how to do CPR, which is really the first link in our ability to improve cardiac arrest resuscitation.
So someone says, somebody's not breathing, they walk them through that whole process,
walk them
even
through.
if they've never done it?
Even if they've never done it. So it's a proven system. We're actually the only accredited dispatch center in Hudson County, and we use pre-arrival instructions that have been certified by the National Association of Emergency Dispatch.
Wow.
And they've run this system across the country to find the exact wording that makes it easiest for bystanders or members of the community to be able to perform CPR.
Wow. So that has helped improve our survival rate, plus the fact that your response time is so good.
Absolutely, yeah. And we say, if you've ever taken a CPR course, there's a saying from the American Heart Association that time is muscle,
Right.
meaning heart muscle.
Right.
And meaning that the quicker that you're able to get CPR on board and the quicker you're able to get a defibrillator in place, the better chance of survivability someone has in cardiac arrest.
Okay.
So for every minute that's lost, it makes a huge difference in someone's ability to survive. And that's why, by reducing the response time by 30%, showed a significant increase in cardiac arrest survivability.
So we provide the EMS service, basic life support, and advanced life support for Jersey City. What about the rest of the county?
Well, we actually we provide, as I said, the basic life support for Jersey City, but we also provide the paramedics for all of Hudson County east of the Hackensack River, so the majority of Hudson County. As I said, those are the individuals that basically what we call mobile intensive care units. They bring the emergency room to the community, and they interface with other EMS providers throughout the county.
Okay, so if another city has an EMS provider, the ALS folks work with them to kind of provide the same kind of service, right?
Yes, absolutely. And we station those units in the same way that we station the basic life support ambulances. We station them around the county.
How come there's not more than one ALS provider?
I'm not sure I understand what you're asking.
So in other words, we're the ALS provider for all of Hudson County, but there's different ambulance services.
Right.
Why do we cover the whole county?
We've been the advanced life support provider since 1978, back when the state first piloted paramedic programs in the state of New Jersey.
Okay.
And the state of New Jersey requires that paramedics operate out of hospitals through what we call a certificate of need. So much like hospitals have certain designations where they might be designated a trauma center as we are, or we might be designated an neonatal intensive care unit like we have at the medical center, they also designate various hospitals to be the paramedic providers. And Jersey City Medical Center was designated as the paramedic provider for Hudson County.
Don't you think it's important too, the fact that, just in what you were just discussing, so we're the trauma center. Obviously, we're also the EMS provider and the advanced life support provider, paramedics and the EMTs working together with the trauma center. That's got to improve the survivability rate for trauma patients, right? If somebody else was providing this service, wouldn't it be kind of disjointed? And
Absolutely, and that's really what I think stimulated the whole idea behind the paramedic programs back in the 1970s, and why in New Jersey every paramedic needs to operate out of a hospital. We talk in our service about the continuum of care, and we talk about the continuum of care from phone pickup all the way to discharge from the hospital. Because here at the medical center, from the moment someone calls 911 with a medical emergency, it's someone that works in our department that's walking them through CPR all the way until the point that they're discharged home from the medical center, from the trauma center, particularly for trauma victims. And that allows us to really do a comprehensive quality improvement analysis, that we can look at every step of the process all along the way to make sure that the proper level of care was provided at every intersection.
now, we've got some new ambulances that we just bought, right? They're really state-of-the-art. But all of our ambulances can provide technology back to the hospital?
Yes, yeah, we actually, this year we purchased 14 new ambulances.
Wow.
And we're looking next year to purchase some additional ambulances as well.
Right.
We did suffer
How
a
much
little
did
bit
that
of a
cost?
It's about, this year we spent about $2 million on new emergency vehicles between ambulances and a few other emergency vehicles.
So
that
we're
we put
really
together.
committed to providing the service.
Absolutely, we're very committed. We believe that it's the right thing to do by the community to take our revenue and reinvest it back into the community, into the services we provide.
Sure. Now, some of the technology, like if you have an EKG on a patient in your ambulance, you transmit that back to the hospital?
Yep. We work hand in hand with the physicians in the emergency department. Every time a paramedic goes out into the community, they call back to a physician in the Jersey City Medical Center and discuss the patient care that's occurring. And they work with them through, when they do an EKG, they'll take that and they can send it back to the medical center through a wireless system that we have. And that allows us to make sure that if a patient needs to go, is having a heart attack and they need to go up to our catheterization lab in the hospital, that we can expedite that process. So the cath lab team is already ready to receive the patient, and in many cases will bypass the emergency room and go straight to the cath lab.
Straight to the cath lab?
Straight
Wow.
to the cath lab.
So the doctor reads kind of what's going on in the field, tells the cath lab, hey, get ready, we got a patient coming, and we take the patient directly up to the cath lab.
Yeah, it's actually, it's pretty amazing technology. We actually use iPhones and BlackBerries, and that EKG is then distributed right directly to the cath lab team, so they can take their iPhone out and read the EKG right on their phone.
That's got to improve survivability for patients.
Absolutely. The response times and the standards and metrics that we look for quality improvement at the medical center for patients that need to have a cath lab treatment are some of the best in the nation in terms of getting patients to there in that 90-minute window that we really look at as the golden
Wow, the
standard.
best in the country, huh?
Some of the best in the country, absolutely.
Well, you talked about the response time being 6 minutes versus 8 or 9 minutes for the nation. I mean, even that in a highly dense urban population, you know, to be able to have that kind of response time is phenomenal.
It really is. It's something that we're extraordinarily proud of, and we truly strive to be the best in the country. As a matter of fact, back in 2009, you know, it's easy for us to look at our own standards and say that we're the best, but we wanted to go out and get some external validation. And so we went to various accrediting bodies and asked them to take a look at what it is that we do and see what their thoughts were. And
well, hold that thought. We'll be right back.
Absolutely.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
Welcome back. We're talking about our EMS service. So, Rob, you were telling us a little bit about the accreditation. So, we're the only AAA accredited EMS service in Hudson County?
Yes, and we were the first in the nation back in 2009.
So, what are the accreditations?
So we brought in 3 agencies. One is the Commission on Accreditation of Ambulance Services, and they looked at our overall operation and validated that what we're doing is in fact meeting the gold standard. And we also brought in an accrediting body to look at our dispatch center and dispatch operations to make sure that we had met those standards through the National Academy of Emergency Dispatch. And then finally, we brought in the Commission on Accreditation of Allied Health Education Programs that looked at our paramedic program and validated that that was in fact one of the highest quality paramedic programs
So we
around.
really are the gold standard. No other EMS provider could provide the same level of accredited services that we provide.
Absolutely. In fact, the Journal of Emergency Medical Services came and visited us to take a look at our operations. And they dubbed us, they said that we were the royal flush in EMS.
Wow.
And the editor-in-chief was quoted in the issue of GEMS Magazine, or the Journal of Emergency Medical Services, as saying that Jersey City Medical Center EMS stands at the pinnacle of EMS, and something we're extraordinarily
Wow, so
proud
like
of.
they think we're the best in the country.
Absolutely. We,
That's
you know,
really great.
we really think we do a great job, and
Yeah.
we strive to be able to provide an environment that others can learn from, and also make sure that we're constantly visiting other services around the country to see what their best practices are, and,
Wow.
and learn and continue to improve ourselves.
So we talked a little bit about buying ambulances. We invested $2 million. Looks like we're going to invest another $2 million. You know, one of the issues that I think is important to our community is that we're really one of the last not-for-profit hospitals in all of Hudson County, and the only one in Jersey City. So what that means is we take that money and reinvest it into new technologies. We have a state-of-the-art medical center, in fact, the only state-of-the-art medical center in Hudson County. We're relatively new. We take all the money that we make as a not-for-profit and reinvest that back into our hospital. Now that's been successful for you, right, with the ambulances, because now they're air-conditioned, they provide a higher level of technology. I mean, tell us a little bit about some of the new things on those ambulances.
No, absolutely, and we are constantly reinvesting in trying to find best practices between the new technology in our dispatch center in terms of using predictive models.
That's right. We just bought a new technology in the dispatch
And
center
then
too, right? Another $500,000
we just spent
on that?
$500,000 upgrading all of our 911 consoles to be the latest and greatest state-of-the-art consoles that now are able to implement services like the GPS locators for cell phones. They can receive text messages, 911 calls if implemented through the county level. So we really are able to move forward with those dispatch consoles into the next 20 years or so.
You know, one of the things that amazes me about the medical center is, too, unlike any other hospital, we're the only trauma center. So we have trauma surgeons who are in-house 24/7, ready to take patients. So when you get a trauma, you get them to the hospital, right? Isn't there like the golden hour that you need to get them to the hospital?
Yeah, we do look at the golden hour, and the integration of trauma services is unparalleled. The ability to, again, as I said, from the dispatchers to our EMTs to our paramedics and right into the trauma center. And one other thing I'll say that I really think is important when we talk about the trauma services is our ability to work together with the hospital in community prevention and injury prevention and some of the other community services that we provide. We operate with the trauma services a car seat check at the Jersey City Medical Center EMS
And don't we do that in
headquarters.
conjunction with the police, right?
We do it in conjunction with the trauma services and the Jersey City Police Department. So we're always trying to find new ways that we can be out in the community and we can improve patients' livelihood, we can improve community health through various pilot programs and things that we can do.
So we were to look 5 years out. What do you think some of the new things that'll